Well, this is fun. Everyone's in a rush to get somewhere. Poor decisions are made, accidents happen, then there's even more traffic. The next thing you know, you're late for dinner. Traffic is similar to having high cholesterol. Cholesterol is like cars on the road passing through the arteries. When there are too many cars, then things become congested and the flow of traffic slows down. Just like too much cholesterol creates a buildup in the arteries and restricts blood flow to the heart. Hi, I'm Dr. Miller. I'm a cardiologist with the Florence Warmold Heart and Vascular Institute at St. Elizabeth. Cholesterol can be tricky. I'm going to show you why it's important, the impact it has on your heart health, and the things that you can do to keep it balanced. So let's buckle up and get started. Cholesterol is a waxy substance that's found in all cells of the body. Among its many functions, cholesterol helps build healthy cells. It's carried through the bloodstream through proteins called lipoproteins. Triglycerides are the most common fat in the bloodstream. They're a part of your cholesterol profile. Having some triglycerides in your blood is normal. The body makes them, and they will come from the food that we eat. Triglycerides are released by fat cells and burned as fuel for the body. Total cholesterol is a measurement of the amount of cholesterol in your blood. The liver makes 80% of the cholesterol. The other 20% comes from what we consume. Foods high in saturated and trans fats cause your liver to make more cholesterol than it should. There are two main types of cholesterol, low-density lipoproteins and high-density lipoproteins. We refer to these as LDL and HDL. The LDL is the bad cholesterol. When the LDL numbers are too high, they enter the walls of your blood vessels and form plaque. This plaque buildup can be in your heart, aorta, arteries in the brain, legs, and other organs. HDL cholesterol is the so-called good cholesterol. It snags the excess cholesterol and deposits in your liver where it can be broken down or removed from the body. Yes, high cholesterol can cause fatty deposits to develop in the blood vessels. Eventually, these deposits grow, make it difficult for enough blood to flow through the arteries, and this slows down or cuts off blood flow to the heart and brain. High cholesterol has no symptoms. A blood test is the only way to detect it. High cholesterol can run in families. Your genes partly determine how much cholesterol your body makes. It can also be a result of unhealthy lifestyle choices. Managing cholesterol levels with lifestyle changes or medication has made the biggest change in reducing heart disease. Cholesterol numbers categorize your risk level for heart disease. Your healthcare provider may recommend cholesterol goals based on your current health or personal risk factors. Ideal numbers for LDL cholesterol in people with zero risk factors, we would consider 130 as the upper limits of normal. Ideal HDL cholesterol to aim for average is men around 40 milligrams per deciliter and women 50 milligrams per deciliter. The American Heart Association recommends checking cholesterol levels once between the ages of 9 and 11, and then again 17 to 21 years of age for those without risk factors or a family history of early heart disease. If there is a strong family history of premature heart disease, such as heart attacks, dying in their 40s, physicians will urge their patients to have their child's cholesterol checked, and there really is no age that's too young. After age of 20, if your risk factors remain low, your healthcare provider will check your cholesterol every 4 to 5 to 6 years. By age 40, have it checked on a routine annual checkup with your primary care physician. Some people with high cholesterol may need medicine to bring their levels down to a healthy range. Medications may be recommended as a part of an overall treatment plan when lifestyle changes have not been successful, such as changes in your diet, exercising, weight loss, and smoking cessation. People with additional risk factors may require medication, such as high blood pressure, previous heart attack or stroke, advanced age, a family history of heart disease, or diabetes mellitus. Cholesterol medications are effective at lowering LDL and triglycerides, protecting against heart attack and stroke. Statins are the most prescribed medication to treat cholesterol and are formulated to block a specific substance that the liver needs to produce cholesterol. This causes the liver to remove cholesterol from the body. Statins are a highly studied class of medicines with a very large studied populations and can be very effective and safe for most people. The effectiveness varies from person to person. Most cholesterol medicines have very few side effects. Mild, temporary reactions include muscle soreness, cramps, weakness, joint pain, diarrhea, constipation, nausea, stomach cramps, and vomiting. A misconception, though, is that statins cause muscle pain or permanent muscle damage. Don't go to Dr. Google when it comes to side effects of medicines. Talk to your doctor about your specific situation or concerns. The types of foods you eat and how much you eat directly impact your cholesterol and triglycerides levels. Heart-healthy eating patterns should include plenty of vegetables and fruit. Try to aim for 5 servings a day. Choose whole grain breads, cereal, pasta, rice, noodles. A variety of protein-rich foods and high-fiber foods. Healthy cooking oils, olives, sunflower, canola, safflower. Choose unprocessed foods. Replace added salt by flavoring foods with herbs and spices. In general, a Mediterranean diet is a good diet to follow. Yes, fiber grabs onto fats and cholesterol and helps excrete them from the body and prevents them from reabsorbing into the bloodstream. Foods high in soluble fiber support healthy cholesterol levels. Be aware of your family history. Relatives who have had heart disease predominantly early in life, and do your homework before your appointment. Understand and know your specific numbers. Sometimes medicines cannot be avoided with the management of cholesterol, so be open-minded. Don't walk into the doctor's office with preconceived stigmas about medications or side effects. Be prepared to ask questions, share your concerns, and allow your doctor to answer them. Thanks for taking the time to learn about cholesterol. You can't control traffic, but now you have the tools you need to take control of your cholesterol levels and help keep them in a healthy range. Check out the other segments on the St. Elizabeth Take Time for Your Heart program and find more tips on lowering your risk for heart disease.